Introduction. Kawasaki disease (KD), also known as Kawasaki syndrome, is an acute febrile illness of unknown cause that primarily affects children younger than 5 years of age. The disease was first described in Japan by Tomisaku Kawasaki in 1967, and the first cases outside of Japan were reported in Hawaii in 1976. Kawasaki disease, also known as mucocutaneous lymph node syndrome, is a rare but serious condition that primarily affects children. The exact cause of Kawasaki disease is unknown, but it is believed to involve an abnormal immune system response. Kawasaki disease causes the blood vessels to become inflamed and swollen, which can lead to complications in the blood vessels that supply blood to the heart, coronary arteries. Without treatment, around 1 in 4 children with Kawasaki disease get heart complications. This can be fatal in about 2% to 3% of cases. Because of this, Kawasaki disease is one of the main causes of acquired heart disease in children under 5 in the UK. Acquired heart disease develops after birth.
Kawasaki disease typically occurs in 3 phases, which is acute, subacute, and convalescent. For first phase, which is acute, most patients develop high spiking fever for about 5 days, associated with irritability, occasional lethargy or intermittent colicky, abdominal pain. This phase is the most intense and symptoms can be the most severe. For the second phase, which is subacute phase, this phase begins as the fever and rash subsides with the tips of the fingers and toes begin to peel often. Patients may also develop joint pain, diarrhea, vomiting, and abdominal pain. This phase usually lasts about 2 weeks. And for the last phase is convalescent phase, which is clinical symptoms gradually fade and disappear about 6 to 8 weeks after acute phase. And for the type of Kawasaki disease, it has 2 types, which is complete and incomplete. For complete types of Kawasaki disease, it requires fever of at least 5 days duration along with 4 or 5 of the principal clinical features. For the first symptoms, it is extremity changes, which is erythema involving the palms and soles, and edema of the dorsum of hands and feet occur during the acute febrile phase of the disease. And for the second symptom is polymorphous rash, usually begins in the nappy area where there may be desquamation early in the disease and spread to involve the trunk, extremities, and face. And for the third symptoms is oropharyngeal changes, which is happen in lips and oral cavity, are characterized by redness, dryness, fissuring, and bleeding of the lips, diffuse erythema of the oropharyngeal mucosa, strawberry-like tongue without vesicles of pseudomembrane formation or ulceration. And for the last symptoms, which is acute unilateral non-purulent cervical lymphadenopathy with lymph node diameter greater than 1.5 cm. And for incomplete types of Kawasaki disease, happen when fever for more than 5 days. It take longer time to characterize the fever because younger age of onset and higher incidence of coronary artery disease compared with complete Kawasaki disease. Kawasaki disease is often difficult to diagnose early because of its incomplete clinical symptoms.
The factor of Kawasaki disease. No one knows what causes Kawasaki disease, but experts don't believe the disease spread from person to person. Some think that Kawasaki disease happens after a bacterial or viral infection or that it's linked to factors in the environment. There are three risk factors. The first one is age. Children under 5 years old are at highest risk of Kawasaki disease. The second one is gender. Children who are assigned male at birth are slightly more likely to get Kawasaki disease. And the third one is ethnicity. Children of Asian or Pacific Islander descent have higher rates of Kawasaki disease.
Next, treatment. Most children fully recover without any damage to the blood vessels if treatment is started within 10 days. In the hospital, the child will be given first gamma globin, second aspirin. The first one, gamma globin, also called intravenous immunoglobulin IVIG, a small tube called a catheter or an IV, is placed in a blood vessel. The IVIG medicine is given through this catheter over several hours as soon as the diagnosis is made. IVIG helps reduce the fever and prevent damage to the blood vessels. Second, aspirin. Baby aspirin is given at regular times, day and night. Aspirin helps control fever and inflammation, and it keeps blood cells from clumping or forming clots. The dose of aspirin will start out high and be decreased after a few days. After treatment, when your child is discharged from hospital, you should be given advice about how to take care of them at home. First, making sure they are as comfortable as possible and they drink plenty of fluids. Second, make sure your child continues taking any medicine that's been prescribed for them and look out for any side effects. Third, your child will be given a follow-up appointment and their heart will continue to be monitored. Fourth, once an ultrasound scan of the heart echocardiogram has confirmed that your child doesn't have any heart abnormalities, they can usually stop taking aspirin. 5. Full recovery could take around 6 weeks, but may take longer in some children. 6. Follow-up treatment may be needed if your child develops further complications.
So, in conclusion, Kawasaki disease is a complex and potentially serious condition that primarily affects children, particularly those under the age of 5. Despite being a rare disorder, its impact on cardiovascular health makes it a matter of significant concern. Not just that, the exact etiology of Kawasaki disease remains elusive, highlighting the need for further research to better understand the underlying mechanism and develop more targeted therapeutic intervention. In raising awareness about Kawasaki disease, it is crucial for healthcare professionals, parents, and educators to recognize its symptoms promptly. Timely intervention can play a pivotal role in preventing long-term cardiac complications and ensuring a more favorable prognosis for affected children. Besides that, by fostering a deeper understanding of the disease, we can work toward improved diagnosis tools, more effective treatment strategies, and ultimately enhance the overall care and well-being of those impacted by Kawasaki disease.